Welcome back to The Pulse. Let's have a conversation about how mentally stable workers are in this country. This afternoon, we are focusing on media personalities and security personalities because the Ghana Psychological Association has revealed in its latest findings that many media practitioners and personnel in the security services in the country are suffering from poor mental health state due to the nature of their work and poor conditions of service. According to the association, studies conducted into the psychological well-being of personnel in the media and security services by some of its members in 2019 and 2020 revealed that personnel in the two sectors experienced what it termed as emotional constipation, as they could not express their grievances due to their job description. Let's get more on this one, and Dr. Collins Sajaman-Bedu, he is the president of the Ghana Psychological Association. He joins me in studio for more. Emotional constipation, God, yeah. I got scared when I saw that. What does that mean?
Well, Aisha, when you get constipation, as we do know, you know how the feeling is like. It's not something comfortable. And by emotional constipation, all that we mean is that people are not free to express themselves. And so you wish to say certain things. You wish to address some concerns you have. But unfortunately, you are not able to do so due to few factors surrounding your work. It is similar to what we call emotional labor, where you try to suppress your emotions, all for the sake of the work that you do.
Okay.
So by emotional constipation or labor, the extent to which media persons suppress their emotions, or in some cases, they also enhance their emotions in order to match up, step up their game as practitioners within the media industry.
Okay. Now, let's first look at the objective of this study, because this is an area which I think a lot of people have not paid attention to.
Yes.
What was the objective first for this study?
Basically, if you look at psychological studies, psychology in general is a field of study and also a field of practice. So what it means is that it's a discipline where people can study to orient themselves, develop understanding about human behavior and why people do the things they do. We also practice it to provide intervention to help the general populace. It doesn't matter where they find themselves, at the workplace, in schools, within the community, and what have you. So the primary goal for this research, between 2010 up to today, we saw a sharp rise in terms of the number of radio stations, the number of television stations we have in Ghana. And that was good. It was an addition to our democracy. It also showed the extent to which people were craving for more knowledge, more ideas, more discussions. But if we had over 200 television stations as at 2017 thereabout, we had over 400 radio stations, it has implications for human resource. It means more people are being employed into the media industry. Now, from a psychological perspective, we realize that not much had been done when it comes to understanding the work structure, the work patterns, the challenges, the psychological health states of media practitioners. And this is what moved the researchers to move into trying to understand what is going on when it comes to the work of media practitioners. If there are any challenges, we want to know, and what is the way out.
Let's look at the methodology, the parameters. What are the criteria, you set for this research?
So if you look at the research that we carried out, we targeted media practitioners, journalists in Accra, Kumasi, and Western region, what we normally call the research triangle of Ghana. And we also looked at how many radio stations, TV stations are within these jurisdictions. And you could actually tell we have a lot of radio stations within these three areas. So we sampled permanent employees, so to speak. So if it has to do with journalists, we wanted permanent ones. We did not include those who were doing their national service, those who were doing attachment. No, exactly. So in terms of inclusion criteria, once you've worked in the media industry for 1 year or more, then you get included. But we're especially interested in the lived experiences, those who have worked for long. So we had two wings of the research. One was a survey where we engaged 336 media practitioners.
Okay.
And then the other one was a qualitative research where we engaged people on a one-on-one interview to understand over the years their experience as media practitioners. What are some of the things that they have gone through? For that particular one, we're interested in what they themselves have experienced.
Okay.
And we gave consideration to those who have worked 5 years or more. So all those who have worked for many years, they were involved. And we engaged about 13 of such ones within these three areas.
Okay. And okay, I'll come to the security parts. Now, let's look at the findings itself. I want you to take me through one after the other. Right. Let's understand why someone like me can get emotional constipation.
All right. So if you look at the findings that we had, I will put it simple. We found two key areas of psychological state. The first part was what we call the psychological states. And then the second aspect is the behavioral response.
Okay.
If you look at the psychological state, it explains their psychology, how they get affected. Now, we found some media practitioners to exhibit depressive symptoms.
Okay.
And then some were overly stressed. Others had what we call emotional dissonance. They wish to be themselves, but they can't be because of the work that they have taken upon themselves.
Okay.
And then suicidal ideations. It was shocking
to
know that some journalists, some media practitioners felt suicidal. And why was this so? The way they are sometimes treated by the public.
Okay.
You get you just go off your line. You get involved in a small mistake. You mispronounce a word.
Okay.
And the public will just lash you, bash you, threaten you with insult and what have you.
Okay.
It could also be a story that you have done. It did not go well with one party or the other groups of people or what have you. And the way they will threaten you. Some people actually felt suicidal at a point in their lives because of how they felt. Then there were nightmares and even insomnia, sleeping problems.
Okay.
These were especially the group of people who are on the field. They go there, we say first in news. You media practitioners, you are the first to see and break the news.
Okay.
First in news means you are the first to witness horrible scenes.
Okay.
And you are humans as well. You see dead bodies when it is an accident. Someone is being raped. You see the incident and what have you. All these pictures are being captured in your memory. And over time, vivid flashes of the memories, you are not able to sleep for days and what have you. And many of such field work journalists were going through this. Then work-life balance was another challenge, especially when it gets to some peaks of moments of some works that you'll be doing. Election moments, event-filled moments. Some will cover back to back without having rest, and it affected their work-life balance. Then turnover intentions. Most media persons will continue to develop themselves because they feel, if you look at the growth structure in the media industry, it's not clear.
Okay.
You don't know from where do you move to. What is the structure of growth in terms of the developmental pattern within the organization? That is also not clear.
Yeah.
So some were likely to also turn over. And the last bit that we found under the psychological health state has to do with superior subordinate bullying.
Okay.
And that one, we saw it clearly from the observation part of the research. We visited the studios, the cockpits, we sat down, we observed, and you could see how the anchor, especially if the person is an experienced one, well-known, a good brand for the organization, shout and scream at others who are supposed to do what and they are not doing it. Sometimes producers will speak into your ears and shout at you, cut the person, and they keep shouting, and you are still looking into the camera. If
My
you don't
producers
take care,
are laughing because they are
you get it. So you see, superior subordinate bullying continue to even happen.
Okay.
And these are the psychological states. In terms of the other one, the behavioral response, some will vent all that they are going through. Some were just engaging in what we call ventilation.
Okay.
Some will weep and weep and weep in the quietness of their homes. Some will stand in front of their mirrors and weep. Some will go to the washroom and weep. Some of the experiences that they go through, they cannot share it with anyone.
Okay.
And then we also found few engaging in wrong coping mechanisms,
Okay.
taking in alcohol, smoking, and then intemperance in social activities.
Okay.
Meaning they try to be busy hanging out with boys. Thank God it's Friday.
Okay.
And then you budidi and what have you.
Really?
So these are some of the psychological aspects of the research that we found.
Okay, so there are key points I picked in all that you've been saying to me. Some I can relate to. If you talk about overly stressed, yes, I can relate to that. Nightmares, sleeping problems. I have my own colleagues who, for instance, witness some events that is making them unable to sleep, even without light, because of the horror and pictures they've seen. So I can relate to that one. If you say depressed, why on earth are they depressed?
It's a number of factors. You know, there is a rationale for anyone trying to be a journalist. So when the very reason why you want to be a journalist is being threatened, it affects your sense of satisfaction.
Okay.
You know, we are motivated from two angles. Either intrinsically, you have the passion that I want to be a journalist. Or there are some because I want to be popular. I want to be seen by everyone on screen, so I want to be a journalist. Which is your motivation? There are some who are highly motivated inwardly to be journalists. So imagine the situation whereby there is an order from someone, get this person off as an anchor. What has the person done?
Okay.
Perhaps in your attempt, in your quest to do your work well, it can make you feel depressed.
Okay.
Because you feel the dissonance. You are doing your best, but it is not being appreciated. It is not liked by the other side.
Yeah.
That is a cause for depression. Some also share the experiences whereby I was engaged as an anchor. When you are no longer needed, you are pushed maybe to stores, you are pushed to reception. It is a psychological way of telling you we don't need you.
Okay.
If you go back home and reflect, if you don't take care, you will definitely get depressed.
Okay.
So it is about the life-changing situations around your work. It can push you to feel depressed.
Okay. So now, you made recommendations?
Certainly.
Definitely, because the fact about stress, fatigue, sleeping problems, and nightmare will continue to happen. The bit about superior subordinate bullying, I'll talk about that. But what are the recommendations you gave in that study to deal with some of these things?
It's very simple. One of the things we found is that many of the media stations do not even freely allow employees to have their own voices.
Okay.
By this, I mean the establishment of unions
Okay.
to actually champion the welfare of the employees.
Okay.
Many organizations, especially within the media industry, are not good at that.
Okay.
And that is the first step. So for instance, multimedia. If you do have a union, it should be strong. If you don't have, this is a wake-up call.
Okay.
Because unions challenge management. It is also a check and a balance to support management to reorient themselves. It is a wake-up call for management to step their game. So that is one of the foremost recommendations that we made.
Okay.
Second, we need to look at the HR structure in media organizations. We realize that we have some kind of ad hoc HR structures within all the media industry.
Okay.
If you have a proper, well-coordinated HR department, directorate, then the lines of progression are clear, the welfare issues are clear, the ethical issues are clear, and it becomes very easy for the HR practitioner to request for psychosocial support. And that was one of the key recommendations. At least every 3 months, those especially who are the forefront of reporting, going to the field and what have you, you need to go through psychosocial support from a psychologist. By that way, you'll be able to reorient yourself, adjust appropriately. If you have any challenges as a result of your job description, you'll be able to adequately deal with them.
Let's look at the bit about the superior subordinate bullying. I mean,
Yes.
from the explanation you gave, I don't see it as bullying. I see it as getting the job done, because that's how we are oriented. That, listen, you can't go about telling your viewers that I did my best, but I didn't get what I was looking for, because you have a date with your guest. At that time, when your guest is seated and waiting for you, you need to give results. So if you have to somersault, you have to swim or dive and do whatever to get the thing done, you have to do it. So how do we balance this? Because definitely when you are getting, if I am a producer and a reporter is frustrating me, I'll definitely, you know, vent my anger. I would let them know that I'm frustrated by your actions. So how do we balance it so we don't give people this emotional trauma you talk about?
So even from your question, I can see the psychological challenges in there.
Okay.
You mentioned about venting your anger.
Yes.
You mentioned frustration. And those are all psychological issues.
Definitely.
So what it means is that we may have to train your editor, your producer on emotional intelligence.
Okay.
And how to regulate her emotions, his emotions. You would also need to be trained on how to regulate your emotions so you don't vent.
Okay.
Remember, the premise of psychology is that individuals differ.
Okay.
Someone, you scream at the person and the person may be okay.
Get disoriented.
Yes, and that is basically what emotional labor or the constipation is about.
It's about.
Because you are screamed at. If it was in a trotro, someone scream at you, what would you do? But because of the job description, you can't scream back.
You can't scream
so
back.
you suppress your emotion in order to do as expected of you.
Okay.
And that is the emotional labor or the emotional constipation. Okay. There is a balance. But the bullying comes when a boss is called by a relevant other that this person, we don't need him. Okay. We don't need her. Okay. You can't air this story. Okay. That becomes a strong element of what?
Definitely.
Bullying. And then the boss impresses upon you not to do what inwardly you have worked so hard that you wish you will air. Okay. The other bit has to do with whereby you are engaged to do a particular job description, particular role. And because there are few challenges, you automatically moved from your position of responsibility to another area. Okay. Then you feel you have been bullied. There is no engagement, no discussion before you do that. So it depends. We are not saying let's water down the job that you are supposed to do. No. Okay. Every organization, every occupation has its own do's and don'ts. Yeah. There are pluses if you want to get it done well. But the point is, we need to also give attention to traces of what? Psychological lapses.
So there must be a balance at all times. But how about the individuals? How do you handle it? Because like you said, there are individual differences. There are people who can handle it when their superiors scream at them. There are those who cannot. And because they are their superiors, they cannot, talk back. So how do you handle the situation as an individual?
Once again, that is where the role of the HR comes in. Periodically, we need to do an assessment. When we talk of performance evaluation or appraisal, it is not what is being done in some public sectors. Okay. At the end of the year, the manager look into the skies and say, oh, that one he did very well. And then you get
notified. Give it to you.
Performance evaluation, behavioral patterns at the workplace should be done every day. So day in, day out, as people are working, you take note of their pluses and their minuses. It is an opportunity to give effective feedback. When you realize this particular employee, the person needs to improve in this area. Okay. That is why you are there as an HR. Okay, if there is opportunity for training, let's help this person there. If it is a one-off situation, one individual needing help in a particular area, what do? There could be one-on-one coaching. I remember I have done one-on-one coaching for some big journalists because they had challenges with kowtowing to authority, following directions, and they needed help to be able to get realigned. So it is at this point that the organization could even recommend, once again, the services of a coach, the services of a psychologist to help these ones to realign them so they can continue to support the organization.
A good one there. I'm picking some tips from what you're saying, but the bit that baffles me is the fact that you're putting media personnel and police officers in the same boat. We do different things. Even though we are all both watchdogs, but our jobs are different. How is it that they're also facing the same challenges that we face?
Well, it's interesting because if you look at what we found in terms of emotional labor, the police industry is a rank organization. You salute when the superior speaks.
Definitely.
So you dare not challenge. It's similar to what we are talking about here. You see the resemblance.
In the media, I mean, I don't see the media space to be saluting all the time. I mean, compared to the security.
Compared to, yes.
Over here, we talked, even our CEO, you can tell him that this one, you're not right on this one. Right. So I don't see that to be similar.
But there are resemblance in terms of how far you can express yourself.
Okay.
And that was linked to the fact that some media stations, you don't even have union. If you don't take care and you overstep your boundaries, you'll be shown the door.
Okay.
Now, the other bit that was closely aligned to the police was the work you do. If there is an accident scene, the media is there to report firsthand. The police are usually there to also report. So in terms of the insomnia, nightmares, images that they will be having, there were similarities. Then when it comes to the HR structure, you could see that, like the media industry, there is an improvement that is seriously required within the security industry.
Okay.
Most security industries, in terms of spreading out so that we're able to account for the well-being and welfare of each officer, there are some lapses that needs improvement.
Okay.
And as far as psychological support is concerned, I will commend the military. They took the lead in engaging the services of psychologists, and they've done well. They continue to improve. And I think the police have also started emulating the fine example of the military, which is very commendable. So the past IGP, the current IGP, they are all committed to supporting the police psychologically. And I think the biggest room none of us can fill in terms of organizations is the room for improvement.
Okay, but of course, the bit about the security is what's making me think, could this explain why we're seeing many police officers commit suicide in recent times?
Well, there are a number of factors that make people perhaps think that life is not worth living.
Okay.
And it is a multifaceted situation. It could be one of them, the fact that they need improvement in their welfare system. They need to improve their psychological health, their conditions of service. And then, like I said, they need a lot of support when it comes to their HR management of the personnel. Because if you think of having close to 40,000 personnel, as we are told, then it will require that we have a lot of personnel who are duly qualified to manage the police service. In my view, we need to decentralize the management of the HR units of the police service. It will not be wrong to have regional officers in charge of HR and even trickle it down to divisional levels so that there will be lower coordination, easy access to help, support, and by so doing, I'm sure. And aside that, you know, their work is very demanding, very, very demanding. If you look at work-life balance, that is one of the challenges that many police officers have. You can be transferred within 2 days and you have to move. So we need to factor in how these officers will also balance their lives, that of their families, that of their children. Granted, it's a security asset to quickly move people here and there, but we need to also be circumspect in terms of how these people reconstitute themselves, that of their family, and then adjust to a new assignment that they may be given.
I'm grateful this afternoon. It's been a wonderful time with you because these are some of the things that nobody talks about but really needs to be talked about. Dr. Collins Ajamambedu, he's president of the Ghana Psychological Association. Truly grateful for your time.